Everyone, Dr. Raval. I am the author of the Physician Practice Blueprint, available on Amazon, of course. But today we're here to talk about a growing concern where physicians are losing their autonomy. So over the last 2 years, about 108,000 physicians left private practice and joined corporations. Within that, over the last few years, what leaders in the industry, in the medical industry, are finding is that most of these doctors are becoming increasingly unhappy with the inability to direct their own patients' care. So what that means is most of these employed physicians have to follow rules that the corporation puts out. If you work for a hospital, you're referring patients only to that hospital, whether it's the best hospital in the area for their particular problem. You're using only that hospital's products, as opposed to other products that are out there that may be better for that patient. And whatever is important for that corporation, let's say it's the amount of time you spend with the patient or the kind of reviews you get, that corporation then begins to dictate whether they still want you based on those whims, we'll call them. So that loss of autonomy, meaning the lack of being able to direct patient care, to control and respond to your own reviews, to continue to stay in practice, are a major concern to physicians. And the biggest concern for leaders is these factors are more based on fiscal, financial decisions by corporations, by hospital systems, by large companies, rather than the quality of care. As opposed to 44% of physicians still practice in a private environment. And I will tell you, as I still do and do quite well, that my financial gain in this is almost 40% higher than my friends and colleagues who have joined corporations. I work about the same number of hours, but also I get to direct my patient care. If one hospital is better than another for a particular care, in my case, let's say ulcer care or cancer care, that's where I get to send them. Also, culturally, I get to send them to areas that are culturally more sensitive. If they don't speak English, for instance, I get to send them to physicians who are bi or multilingual. I am not obligated or stand by the whims of a corporation, meaning if I have one bad review and 100 good reviews, my bad review doesn't get me fired. Just a thought for you, the book is here to build your own brand and be able to function independently, and also to restore physician autonomy. Hope this helps.